Good morning.
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 Good morning, fans. How are you doing this morning?
Morning.
Well, apparently nobody's a fan.
Morning, everybody.
Morning.
Morning, Vicki. Okay, well, so much for that.
Good morning. This is Barbara Hare from Hera.
Morning, Barb.
Morning,
Good
Barbara.
morning. Good morning.
Oh, last day of the month. Yay.
Yep.
It's good and bad, isn't it?
Feels like fall this morning too.
Yeah.
Wendy, I don't see anyone else on the call besides staff and board members.
Yeah, I'm admitting everybody that is popping up here. So,
Okay, just checking.
yeah.
You all look very you're too serious. Come on.
Well, it's the Board of Health meeting, sir. This is how we act.
Well, this is Kay Funk. I don't mean to be too serious, but the death of Norm Childress was really shocking and tragic, and certainly puts us in mind that tragedy can come upon us in the most unexpected ways, and so sad that a person who made such an enormous positive contribution to community service was lost this way.
Yep.
Thank you for saying that, Kay. It's been a really difficult time, and he was a wonderful man, lots of amazing experience, and brought a lot to our team and the Board of Health, of course, too. And, you know, I just can't believe it still.
I had known, this is Barbara, I had known Norm for probably at least 30, maybe 35 or 40 years. And his goal was always to do the best for the community. And he worked so hard for as a public works person in Benton County for years. And then when he retired from that, he told me that he told me years ago that when he retired from his main job, he wanted to continue helping everyone in the community and in the county.
And that he certainly did, Barb. Thank you.
Yes, he did.
Gail? Gail, are you with us this morning?
Taylor, I don't know if you're
Yeah.
muted somewhere else on your computer, but we can't hear you.
Okay, I'll maybe call her.
There's also the *1 option. If for some reason you're self-muted, you can push *1.
What?
Commissioner Anderson? Commissioner Anderson?
Yes, sir.
Gail's having some difficulties with the muting process, so she's going to jump off and come back on. If you care to share the meeting and open it, and then we
Okay.
can process.
Okay. Do we welcome everybody? Ryan, would you like to take roll call? So
Yes,
make
I
sure we
will.
have a quorum.
Okay. So we'll start with board members. We have Barbara Hare, City Representative, Mayor of Hera.
Here.
Ron Anderson, Commissioner.
Here.
Dr. Kay Funk, City Representative, City Councilperson from the City of Yakima.
Here.
Vicki Baker, Commissioner.
Yep, I'm here.
Dr. Sean Clary, Citizen Member.
Here.
Hey, Ryan. Sean Cleary's having a weak signal, so he's going to try to jump on soon.
Who was that?
Hopefully I hooked up for a little bit here.
Okay. And then we have Gail Weaver, Citizen Member, Board Chair. is present. Yakima Health District staff, we have Andre Fresco, Executive Director.
Present.
Myself, Ryan Ibach, Chief Operating Officer. Chase Porter, Senior Finance Manager.
Here.
Melissa Sixberry, Director of Disease Control.
Here.
Lillian Bravo, Director of Public Health Partnerships.
Here, good morning.
John McGee, Environmental Health Director.
Here, good morning.
Nathan Johnson, Local Emergency Response Coordinator.
Good morning.
Dr. Teresa Everson, Health Officer.
Good morning, I'm here.
Wendy Garcia, Public Health Technician.
Morning, I'm here.
Victoria Reyes, Administrative Assistant.
Here.
James Elliott, Attorney.
Good morning.
Good morning. Any other staff members? Okay, and at this time, if you're a guest or press, if you could type your name and affiliation in the chat box, and please limit it to only your name and affiliation. We will not take any written comments at this time during the meeting. And then
I have a quick announcement. Sorry to interrupt. I just got a call from someone trying to log into the meeting, a citizen. The link on our website is not working.
Yes. So yeah, and Victoria has received other emails too, and so what she's having to do is send a direct invite to the people. The link is working on her end, so we're not sure what the problem is, but
Okay.
but we'll go ahead and if people let Victoria know if anyone calls and you can send them a direct invite.
Okay. Thank you.
Okay. All right. Thank you. And then we'll be checking the chat box throughout the meeting, and also reminding people to put their name and affiliation in the chat box throughout the meeting. Thank you.
Ryan, Dr. Cleary's joined us.
Okay.
Gail, are you on yet? No,
Well, she is on, but
but well, I mean, the audio is not on.
yes, I am so sorry. Well, I can check also, Gail, if you'd like to connect in through the telephone, we can do that as well.
Okay, in the meantime, I guess we'll proceed. Was there any review of submitted public comments?
Yes, we have one set of some submitted comments, and this is by Amanda McKinney. And she asked, what exact measurements will YHD be using to determine case counts and hospitalization rates that are no longer determined to be, when the county is no longer to be determined to be stable? She also asked, what is the process for notifying the school districts they must cease in-person and or hybrid learning? When will you post outlines for Yakima County's proposed phase 2, 3, and 4 plans? And why are businesses required to submit a written plan to move forward? And so these questions will be answered throughout the meeting.
Okay, thank you. Any other comments? That's it?
That was the only written comment submitted.
Okay, so then we'll move on to number 4, the consent agenda. I would look for a motion to approve if everybody's had an opportunity to read those.
I approve the agenda for the minutes of the agenda of the August 26th meeting. I move to approve it.
Is there a second?
Second.
Was that you, Vicky, that seconded it?
Oh, this was K Funk.
Okay. Okay, there's been a motion and a second. Any comment? Hearing none. All those in favor?
Aye.
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 Okay, any opposed? Hearing none, motion passes. We'll move on to board business. Andre?
Yes, good morning. Thank you, Commissioner Anderson, and my apologies for the difficulties as we continue to navigate these virtual meetings. I wanted to, oh, pardon me for 1 second. I have Gail calling in. Pardon me, I'll just put you on.
Okay.
All right. Thank you for your patience, everyone. Gail's joined us on the meeting.
Oh, good.
So I would like to begin by sharing, again, our collective condolences for the loss of Commissioner Childress. This has been a difficult time for us, obviously, and I wanted to share that we, again, were surprised and saddened by his loss. As a board member, his voice was clear. He believed in service. He believed in high expectations for government employees, and he believed in our valley. So I wanted to share that we mourn his loss, and we went ahead and had a desk plaque made for his wife in his honor. And if you don't mind, I'll just read it. It says, "In recognition of health leadership and public service to the citizens of the Yakima Valley." So
Oh, how nice. Thank you. Thank you.
well, he certainly deserved it. So thank you.
Thank you, Andre.
And thank you all for your continued service as members of the Board of Health in these difficult times. This is really unprecedented. And again, to have such a tragic loss in the middle of not only coronavirus, but also devastating fires, it's certainly been a difficult end of the summer for our community. So thank you again for your support and continued commitment. I wanted to begin by talking about COVID-19. Obviously, we'll go into depth with our directors, so I don't need to share anything that they would share. But again, we continue to remain vigilant in planning for continued success in our valley. That is our goal. And we have been helped by funding that's come from the Department of Health. That's part of what we refer to as our consolidated contract. This is federal dollars coming through the state through what's called the CARES Act funding process. And we received ample funding that will allow us to move through the end of this year for all the programs that we believe are necessary to keep people safe. So that was welcome. The timing's interesting because, again, it has to be used through the end of the year. But what that also does is it allows us to have funding available that we can maximize through current grants that we've received earlier in this year. And we can use COVID-related monies in next fiscal year, which was something that we are really excited about because in terms of planning for a budget, it's our responsibility to bring to you a strong budget and a budget that reflects the needs of our community, and certainly COVID-19 will continue. I will share with you that we have no certainty about the funding streams from the state or the federal government in 2021, except we do have these maximized grants that Chase will get into more. But I'm very pleased about that because this has really been just-in-time work by our staff, our finance team, and Ryan specifically to make certain that we are healthy and balanced financially as we move through this response effort. So I wanted to really share the largest issue with you, which is our proposed budget in 2021. Again, our plan is always to bring a budget to you for your review, certainly before adoption. And we have historically done that in September with the proposed adoption being in October. We don't meet in November. And so this allows us to either adopt the budget in December, if you so choose, or in October. So that's our plan, and we've been fortunate to do so. Briefly, I'd like to share that it's a very strong budget. We've spent a considerable amount of time reaching out to our partners at the state level to find out if our program funding streams are going to remain strong. We anticipated that there would be reductions, and there actually haven't been. So we have a very strong budget that's proposed for you. We have additional COVID-19 dollars that we plan to use, and our financial outlook is strong. We have a really exemplary staff who remain with us and committed to the work that we're doing together, and so that will be reflected in the budget as well. So what I'd like to do now, if you don't mind, is to ask Chase just to review highlights of the budget, and this will be shown on our screen by Victoria, and then we'll also email that to you. For you.
Oh, good.
Good. Okay.
Chase?
Okay, well, good morning, everyone. Victoria, this is not the first page. Will you move up to the first page. Oh, no, you were on the budget. Is that the only? Yes, keep scrolling up, please. Is that there we go. There we are. Thank you very much. Well, good morning, everybody. This is our 2021 proposed budget. So just a few housekeeping things. This will be sent out at the end of the meeting to all the board members that would like a copy of that. It will also be available on our website. So if anybody in the public would like to review it, it will be posted on our website. We will be putting out a public notification in the Yakima Herald for next month's board meeting to let everybody know that the budget is up, and then we'll be up for adoption hopefully at the end of October for our next Board of Health meeting. So Vicki, will you please move into the next page? This first page is our planned FTEs for 2021. We've increased by 1 FTE, what we're planning to do. We are certainly budgeting right now in unprecedented times. We don't have a lot of experience with what's going on right now. If we had our way, we would certainly not be budgeting the way we have been this past year. We would go back to normal. Right now we have 32 FTEs, and that's our plan for 2021. This is a breakout of the directors and kind of where those FTEs fall by position and director. Vicki, will you move into the next page, please? This next page, is there a way you could zoom out slightly? I think I got my there, just a slight zoom out. Thank you. So this is our what we're calling is the summary page. We're looking at our summary of our major levels. Like the first one is our indirect programs, is more or less our administration. As you can see, last year in 2021, we budgeted about $1 million, and we're dropping it down to $826,000. So a sizable decrease with that. As you can see over on the far right, it explains the changes of what we're seeing as far as dollar and FTE. And so we're expecting an increase of that and almost two full FTEs. What we're seeing a lot this year is our indirect or administration is spending all their time in COVID. So that would be Andre, Ryan, Lillian, myself. We spend a lot of time, what we call in support roles. And a lot of those support roles are actually allocated out to each individual program. But we're not doing that so much anymore because we're not having those same expenses as Andre, Ryan, Lillian are all working in COVID. And you can see that also as well as strategic planning and partnerships, the one right next below the indirect programs. You can see we're almost losing a full FTE in that, and that's mainly Lillian's time. I'd also like to point out that we are not explaining anything that's $2,000 or less. We didn't want to get too deep into the weeds, so to speak. So if there's any thing that I'm going over that you would like me to explain a little bit more, I'd be happy to do that. Just please let me know. As you can see, a lot of our stuff, a lot of our FTEs and our budget is falling into community health, communicable diseases. This is a major increase, $1 million and almost 4.5 FTEs for that are being redirected to fight COVID. And as we move down through that, we're seeing slight decreases for most programs. One thing that's happened, the BCCHP program, we've lost a seat in that. So it's just the BCHP program. DOH has renewed that program, and we no longer have the colon piece. It is just breast cervical health program now. So maybe I can remember that acronym and get it right a little bit easier now. Moving down into the EH section, a lot of the major increase you'll see is in the food program. Where a lot of our people that when they're inspecting restaurants right now, they're also checking to make sure that there's social distancing and proper cleaning and those kind of things. So a lot of that expense is actually landing in COVID as well. because that's a part of what their job is doing now when they go out to do inspections, is to monitor COVID fighting responses. So that's the summary of it. As you can see, a lot of our day job is being directed towards COVID, and that's certainly being reflected in the budget. Is there any questions about the summary page? Okay, I'll move into the next page. The next page is details. Really is what it is. It's just detailing, explaining per program. What you were just looking at above was the summary, and now this is getting into the weeds, so to speak. I just wanted to point out 325 on this sheet. It's down to community health, communicable disease. 325 COVID response. For 2020, it was $0, and then we see almost a $1.2 million increase in that. So that's, I just wanted to point that out where that is in this direct programs detailed sheet. Victoria, would you please move into the next page? And then this is more of the detail. I won't get into the weeds with you. However, this is the second half of that. Any questions so far? All right, next page, please, Victoria.
This is Kay Funk. I have a question.
Yes.
We've had some discussion about the difficulty with answering the phone calls, the increased volume of phone calls, questions from the public. I see that one FTE was added to administration. Is that, what's your experience? Is that enough to meet the need?
Yeah, we've actually contracted out. We have a professional service where we have an individual here at the office picking up the phone all the time. She's completely dedicated to picking up the phone. A part of this COVID response is we're receiving dollars from DOH to hire professional services, whether that's in-house to pick up the phone or community tracers, community specialists, all those kind of things. So a lot of that isn't individual FTEs that we're increasing in the health district. We are actually contracting a lot of that out as professional services.
And we do monitor our call volumes, and so at times when we open businesses and we get a lot more call volume, then we do add more staff to answer those questions until the call volume goes down.
Right.
And your outside contractor helps support that as well?
Yes. Yes. Uh-huh.
Okay. I think it's a good solution, and if you'll point out where that shows up in the budget, I'd appreciate that.
Sure. Yeah, it is not directly, we don't have that on this sheet directly for COVID, but I can move, Victoria, would you please move into the next line, please? Or the next page?
Yeah.
This is where we'll see most of that increase. If you look down, I'm sorry, Kate?
That's fine. I'm not trying to interrupt. I just hope you'll mention it when we get to it. Thank you so much.
Okay, absolutely. So then I'll continue through the revenue, and then we'll get down to that detail here very soon. So the revenue piece, we see a large increase for federal and state, almost $900,000 in federal and almost $300,000 in state. That is a direct result of the state moving and the federal government moving funds to help combat COVID-19. And as you know, we've all Yakima Valley is been high profile in the state, so they're moving the money to help address our needs here in the valley. We're expecting an increase in foundational public health services revenue this coming year. But we're also expecting a decrease in fees, permits, and licensing. We're seeing that currently businesses aren't renewing as far as food licenses go, and we're having a slowdown in building. It's just local economy seems to be slowing down, and we're starting to see that as well. We're moving into the expenditures now. Is there any questions about revenue? Okay, moving down in expenditures, you are, oops, go back up, please, Victoria. We're still on that, yes. Thank you. So the expenditures for salaries and wages, there's a sizable increase, and that has to do with the additional 1 FTE and expected increases to annual salaries. The advertising promotional is a huge increase, 151,000, over 1,000%. That's really community awareness. You'll see that in our financials today, that we are advertising, promoting out in the community to help people become aware and how to combat COVID-19. Moving down into the professional services. Same page, Victoria, but down in those professional services, we have accounting, county indirect, health officer, legal, technology, other. This is where the majority of our increases come from. We're seeing a major uptick with our health officer. We're seeing a major uptick in our legal services that we need. And finally, the professional services, other. That's where we're doing a lot of our contracting out of there. We have an increase of about $78,000 for that. So we're going to see phone support and other communicable disease support for contracted services. That's where we'll see those expenditures coming from. The rest, provider service, medical, fed and state, has to do with the BCHP program. For that, there has not been a large increase, just kind of moving buckets, or large decrease, just moving buckets around. Upticks in like for telecommunication with telephone and fuel. We move into the next page, Victoria. And then also you see travel. But we're also still continuing to pursue the Kresge grant and activities. They're have good possible knowledge. Dr. Funk, does that answer your question?
Yes, I'll bring it up later. I'm more interested in operational questions, which are somewhat expressed in the budget, but more, you get a better look at it if we think of it operationally. But I'm very satisfied with the financial presentation. I guess I'd like to say that I think the financial management of the health district has been exemplary, and I feel very confident about the budget that you're presenting.
Well, thank you very much, Dr. Funk. That means a lot. Thank you. That's very, very nice. Thank you. Is there any other questions? Okay, that's our proposed 2021 budget. Thank you.
Well, thank you, Chase, for introducing that with me. We're happy to answer any questions you have. I certainly don't want to monopolize the conversation. I'm certain there are many things that people would like to discuss, and we also have our director's reports. Okay, Commissioner Anderson, thank you so much.
Oh.
Victoria, can you pull up the agenda, please?
So, Commissioner Anderson, we would be doing back-to-back financial reports at this time.
Yeah.
Okay, so that's me again, huh? Will you please, Victoria, move down into page 9? This would be page 8. As last month I pointed out, our vouchers approval was lower, but this is the catch up for that. One more time. Sorry, the page number 9. So that's page numbered 8, and then so page number 9. I guess it would be page 10 on the PDF. Thank you. Can you move in so we can see the full grid, please? Okay, thank you. So for the month of August, we had just about 94,000 in excess revenue, bringing our total year to date through August up to 653,000. Our allocated budget, we expected to be for revenue $4.3 million and expenditures to be 4.5. And our actual for revenue is 4.5 and expenditures 3.9 million. Any questions about the summary? I'm going to, in the sake of time, I'm going to move a little quicker. If you have any questions, please let me know. I would be happy to address them. Moving down to the income statement, please. Okay, so we're getting to the tail end of the year, and we're starting to see some of those fluctuations within our year to date. As you can see, our federal and our state is quite a bit higher than we expected it to be, by almost 900,000. So that has a lot. That has everything to do with our combat with versus COVID. That is being fully funded. So that is the increases for that. Our fees and permits and licensing, as you can see, has dropped. It was a lot less than we would expected it to be, and that has everything to do again with a bit of the local economic slowdown. Developmental disabilities, we're seeing that as well. Those are mainly service industries. For the people that take advantage of that program, they mainly work in service type jobs, and a lot of those went away. And so we are still continuing to fund them. There's a special COVID program for the development disabilities to help those vendors and those employees stay afloat. So we are funneling, or we're making sure that we're working with the vendors so that they're still continuing to maximize their grants. However, there is a unexpected downtick in that program. Moving down into the expenses. So advertising, I just wanted to point out advertising promotional. Man, we really blew the budget on that one. We expected that to be just under 6,000, and we spent almost $111,000 in advertising promotional so far this year. A lot of that is getting just advertising out, and so we're doing the building blocks as far as commercials and communication out to the community now that we'll continue to see into the next year. Moving down into the professional services on this piece, looking at the year-to-date columns, as you can see, we are way over in many of those positions, especially the health officer and the legal. That's why we increased our budget this year quite a bit for those activities. We certainly need their help. Any questions so far? All right, next page, please. Next page, please, Victoria. Thank you. Okay, there's not a lot to note, I guess, other than travel. I guess that would be the one counter expense. We expected major travel this year. We had a lot of training, different things to do, and that just hasn't gotten done. Any questions at this time?
Are you anticipating, Chase, are you anticipating being able to continue in person next year, or how's that shaping up?
Sorry, Ron, in person next year. Oh, in person regarding?
Regarding training and those things.
Oh, yeah, a lot of trainings and those type of things have moved to online forums. They're doing what they did for conferences. They're doing those online now. No, training is very, very important to us. However, many training sessions have been canceled. We aren't expecting to have the same level this next coming year. However, we do have Kresge grant funds that we might be able to use for travel, but no, we expect travel to be a bit down.
Okay,
thank you. Other than Kresge.
This is Kay Funk.
Yes, Dr. Funk.
I'm sorry I missed this, but I was concerned about how the health district was managing expenses or how the health district was reimbursing the additional work hours for the staff.
Mhm.
Could we look at those actual expense numbers?
Okay, I don't maybe have that prepared for you at this moment, Dr. Funk. Are you talking about like our staff as far as overtime and those type of things?
Yes.
Okay.
Yeah.
Yeah, we've certainly had periods of overtime. We've had our staff work the 4th of July weekend. We are certainly following all L&I regulations. If anybody gets over 40 hours within the week, they're getting paid overtime. We have shift differential. So if anybody's working outside 8 to 5 o'clock, 8 a.m. to 5 p.m., I think it's 7:30 a.m. to 5:30 p.m., I believe. If they're working outside of those hours, they get extra compensation called shift differential. We also have weekend differential, where if they are working over the weekend, they will receive a little extra compensation for that.
Do you have a overtime function for salaried employees?
Yes, Dr. Funk, we had discussed previously a temporary increase for our directors during COVID-19, and we can actually get numbers to you, and that's what we had discussed doing.
Well, has that been done?
Yes, on a temporary basis, it has been done, yes. And we'll continue to have those conversations with you about what we do in terms of plans for the future as well, which we can do certainly in the future, and get you some more specifics, numbers and so forth.
Okay, well, it's my fault that I missed this in the actual expenses. I'm sorry, but what line item is that in?
Wendy, I think Wendy's actually the one that's driving. Wendy, will you scroll up a little bit for our overall expenses? Just a bit more, Wendy. There we are. So expenses, salaries, and wages. So our overall payroll expense is at just under, well, just about $1.8 million. We did budget at 1.9. We generally try to over budget for not over budget, but have a little bit of a cushion there. Secondly, we were vacant some positions at the beginning of this year. We were highly compensated employees. We had a vacant nurse. So we were down a nurse, I think, up until just recently, I believe she came on in August, maybe July. Also an accountant. Our accountant also just came on. We were missing an accountant for the majority of the year. So that's really why we're seeing a dip in those expenses. As you can see, on the monthly one, we're slightly under, or just under what we would have budgeted on a monthly basis. So the reason why that seems so big and differences our actual versus budget is that we had a couple open positions for highly compensated employees for a good chunk of the year.
Okay, well, I guess I would just like to know what amount of money came from the unfilled positions to staff compensation, and I don't need that information right now. Thank you.
Okay. I just write that down in the note. Wendy, will you go down into the program summaries now, please? So, yep. One more page, please. There we go. Thank you. So this is our program summaries. If you have any specific questions, please let me know. The one that you can see that really draws your attention to is right in the middle is the COVID-19 response. We've spent just over $1 million so far in that this year. Our EH down in the blue is starting to see some rebounds in that. It was kind of a bit of a break-even month for those programs. However, we're starting to see a bit of a rebound, even if it is so late in the year. Next page, please, Wendy. The same thing here with our EH. We are seeing in the white, the vital records. We're having still a lot of demand, but not quite the matching revenue because of our front office has been closed. But the demand has really been over the phone. We hired an outside contractor to help us pick up the phone, but we also have coverage internally picking up the phone. So we could have 2-3 people just covering the phones depending on the volume. Okay, any questions about programs? Okay, can you move into the last page, please? Oh, no, this isn't the last page. I'm sorry. This is our COVID billing, our income statement, so to speak. Can you zoom in just slightly, please?
Oh, mine's cut off.
So there we go. This is more or less breaking even in this program. We are just charging per what our revenue is matching our expenses. As you can see, Dr. Funk here, we've spent $463,000 in wages, $160 in benefits, so a total of $624,000 so far in salaries and wages in this program. And then the professional services, if you go down, you can see those are our large chunks of our overages are coming from here. Our health officer has spent about $66,000, and then legal, $46,000. And just under 11,000 for our other professional services.
Chase, follow up with Kay's question because it was a good one about answering the phone. And I appreciate having the service to do that. I think that's absolutely the right thing to do, is to get a live body when you answer. I guess my question is, are there enough staff behind that body to really get the answer the public is calling in on? Because I know that you're getting a lot of questions that are very detailed and specific, and people like Sean and Ryan are very, very busy. So do you have enough staff for that?
Yes, yeah. We like we said, the people that are picking up the phone are first of all very knowledgeable. We actually have we meet a couple times during the week to talk about new things that are happening. If we're seeing a change in phase or direction, we always have a preemptive meeting to make sure that everybody that is knowledgeable about the latest changes. And yes, if it's depending on what the question is, this individual Rosie will forward that on. If she is unable to answer that, she will forward that on. And we have several people, not just Sean and Brian, but we have Cease and Mary, and we have a few other people that are helping with those weird one-off questions that Rosie or any of the other front desk can't seem to answer. They'll take down their information and then they'll call them back. They do a very good job with the callbacks.
This is Kay Funk.
Yes, Dr. Funk.
Yes, I just want to be a little bit more explicit that sometimes healthcare is no good deed goes unpunished. And if we want to get good quality service, good quality expertise, we really have to value our staff and the people who have the knowledge to do the job. So when I see this 624,000 payroll expense added on for COVID, I'm thankful for that. And we need to be aware of staff morale, staff satisfaction. Otherwise, people leave because they have other options.
Yes, Dr. Funk, thank you for bringing that up. I'd like to address the fact that we've been very fortunate that the staff have been so committed. We as directors have been very aware of, acutely concerned for the welfare of our staff. And we've seen throughout the state actually people leaving in droves from public health. Many counties are losing a number of staff. I think the average is at least 4 staff per county. We have not seen that here. So we, again, remain very committed to staff morale, benefits, and certainly, the realities that people are navigating this both professionally and in their personal lives. So thank you for bringing that up.
I'm very glad that you have that information and validated what would otherwise be an abstract concern. And I'm glad that you're paying attention to this because it is a real risk to the provision of service to the public. Thank you.
But yes, Dr. Funk, we certainly recognize that we have quality employees, and we're certainly making sure that we're keeping them, doing our best to keep them here. That is certainly thing. And we even try to manage their hours to make sure that they're not getting too fatigued. That is certainly a concern of ours. So thank you. Okay, Wendy, last page, please. And this is our cash flow. As you can see, we always see a bit of an uptick in July as we receive foundational dollars, our flexible dollars. We receive $500,000 in January and July. And that's why that large increase that we see in those 2 months. And then we'll start to see a decrease in these in our overall cash as we go throughout the year, finish up the year. That is the financial report. Is there any questions?
Hearing none. Thank you, Chase.
Thank you.
Next, we'll move on to Chief Operating Officer Ryan.
Commissioner Anderson, if I can ask you, please, can we have a motion to adopt the financial?
Oh, I'm sorry. Yes, can we have a motion to adopt the budget?
The financials for August.
August.
Yeah, this is Funk. I move to adopt the budget.
Forgive me, ma'am. We're going to ask you if you would care to adopt the financials for August.
Very sorry. I move to adopt the financial report for August and the preliminary work going into the budget. Thank you.
And if that's the possibility, Commissioner, for a second. Commissioner Anderson.
Is there a second?
Second.
Seconded by Commissioner Baker. Any discussion? Hearing none. All those in favor say aye or raise your hand.
Aye.
Aye.
Those opposed? Hearing none. Motion passes.
Thank you. And Gail Weaver did vote aye. Thank you.
Okay, thank you. Okay, now we'll move on to Chief Operating Officer Ryan for his report.
Thank you. At this time, before I start my report, I want to just ask any guests or press that have joined since the beginning of the meeting that have not identified themselves in the chat, if you could identify yourself and your affiliation, please. And also at this time, just want to remind that we're not taking any further comments. So just please only in the chat state your name and your affiliation. Thank you. So the first thing I want to talk about is community-based testing. So last month at our Board of Health meeting, we discussed how the National Guard unit that did community-based testing was being reassigned to other counties that are considered hotspots. So we do have a Medical Teams International, which is MTI, that's doing, they're specialized in targeted testing. So they do testing at businesses or assisted living facilities or farm worker housing facilities. However, they have agreed to do 1 or 2 days a week to do community-based testing until we can fill the void. And the void is going to be filled with a group that's called Health Commons. And I believe I talked about them last month. Health Commons is a group that made up of King County firefighters, University of Washington Medicine, and other nonprofits in King County that did community-based testing in Seattle. And the State Department of Health really liked the model that they use, and so they've contracted with Health Commons to go throughout the state and train other counties to do, and partners to do community-based testing. And so we've been approved for 2 sites in Yakima County to do high throughput community-based testing, up to 500 tests per day per site. And so we have contracted with Signal Health, which is affiliated with Virginia Mason, to do a community-based testing site at the State Fair Park. And then we're working with Astria to possibly do a site in the Lower Valley. Health Commons can only work with one team at a time. So they just got done with Benton Franklin County, getting their site up. And so now they're working with us. And we hope to have that high throughput testing site, which will be operating Tuesday through Saturday, and then one evening per week, have it up in the next couple of weeks. So right now we're in the finalizing the planning, and Signal Health, the partner, is hiring today. They're starting the hiring process to get about 20 people on board. We're also working with Comprehensive Health. Will also be helping out with that testing site as far as staffing. Any questions on community-based testing before I move on to schools? Okay. So schools, we've been working with superintendents and principals and the public since the end of May. So before school even got out in the spring, we've been working on a plan to move forward with what school looks like in the fall. Every week there's a superintendent meeting on Mondays that I attend. And so we've been working with superintendents since May to come up with a plan. There's back in the beginning of summer, came up with a plan for 3 different options. So a remote option, a hybrid option, and an in-person learning option. As we move forward, we continually every week talking with superintendents, daily calls with principals. If they have any questions, we've been working with the ESD, Educational Service District 105, to work out plans. We've had internal meetings with school districts and with their administrators, and answering any questions and helping work with their plans. A lot of school districts had advisory groups. So these advisory groups were made up of administrators, made up of staff, which included teachers, maintenance people, transportation staff, food service staff, and then also parents were involved in these advisory groups. And so we were included on many of these advisory groups throughout the county, and to discuss how to move forward, discuss what the plan looks like in a lot of these school districts, so that when it came time to go to in-person learning, that there was input from all members. We've also been working with State Department of Health. We've been working with other health departments as far as what they're doing. We've been talking to, as we move forward, we've been talking to school districts in Kittitas County, Spokane County. We've been talking to Benton Franklin school districts as far as what their plan is. And it's been really valuable talking to other schools like the Meade School District, who's been in-person learning, with Kittitas County school districts, to see what their lessons learned are, how they would do things different. And so it's been really, really valuable. One thing that they'd mentioned that we heard a lot was that things will be, a little bumpy at first, but they noticed that once kids and staff got used to the routine, that things improved, over each day, continue to improve. There's been 9 private schools that have been in school, in-person learning. We have not had any positive cases in those private schools. One thing that we're doing is with private schools is they've been required to submit a plan, a safety plan, required to submit a floor plan, required to submit their class rosters so we can see how kids are being cohorted. We've gone in, they're required to have letters. So if there was a positive case in school, how they're going to have a communication ready to send to parents and to staff. If there is a class that needs to be stations. We will be doing all these measures for public schools. And like I said, we're in constant communication with superintendents and with principals. And so as far as exact measures that will be used to determine case counts and hospitalizations rates, we'll be looking at not only case counts, but we'll be looking at where hospitalizations are. We'll be looking at positivity rates. We'll be looking at cases in schools. If there are any hot spots or any outbreaks, then we'll be communicating with superintendents and with principals, and to make that decision of how we're going to move forward. We're also meeting a weekly meeting with school nurses, and so we have a plan in place. And part of the plan that's required is what are you going to do if student is showing symptoms? How are you going to communicate how long the person needs to quarantine or isolate? When can a staff member or a student come back? who needs to be quarantined. And so, as far as siblings or close contacts. And so we've been working weekly with school nurses and the medical units to decide the flow chart and how that's going to look. So if there is a positive case, there's two-way communication. If we find out, then we'll be contacting the school. If the schools find out, they'll be contacting us so we can get on it right away. And we do have our COVID disease response team that will be also in charge of making sure that everyone is being quarantined that has close contact with the positive person. At this point, we have a baseline. We know that there's about 3 school-age kids per day that are testing positive. And so we already know that exists without school being in session. And so we know that daily we'll be contacting schools and letting them know that there is a positive if they aren't already aware, and we'll be working on mitigation measures. Any questions?
I have a question for you, Ryan, on when you said mitigation, that if there's a cluster like we've had in essential work, we've seen some clusters in some of the big employers, but they continue to open and work through it. Is there any discussion of shutdowns or anything like that? Are you going to plan on working through it?
Yes, and we have a plan in place, and we have expressed a plan, worked with superintendents on how that looks. And so a lot of it is based on circumstances. There's not just one set. If there's one person in a class, we're going to close it down. It depends on the number of kids in the classroom, depends on age, depends on how long they've been in the classroom together, depends on what type of activities were involved in that classroom. And so what we'll be doing is working with teachers and principals and superintendents on whether we need to, once we quarantine kids, do we need to, is it community spread or is it school spread? Because we know that at least 3 kids a day are getting it just from the community. And so we'll be discussing all the scenarios, all the circumstances, and making a decision if we need to close a classroom, if there's several classrooms closed or we can't properly staff, have enough teaching staff, then we'll discuss about closing the school.
Okay, I have one more. Could you explain the rationale for anybody who's listening on the gradual opening, the age groups, and kind of how the rationale behind that and where you came up with that?
Yes, and Dr. Everson will be discussing the rationale in her report. So I'll leave that to Dr. Everson. But I do want to express that one thing we had to do was, in our conversations all summer long with superintendents, is one of their highest priorities is the safety of the staff and the students. And so they want to move forward. Everyone knows that it's important. In-person education is a lot more valuable than remote. However, everyone wants to move cautiously. And so what we did is we set dates. We were advised by the State Department of Health, State Secretary of Health, Dr. Weisman, and State Health Officer, Dr. Lofi, to look at our own individual data, look at our unique circumstances in Yakima County, and if there's a way to open, then move forward in a safe manner. And so we've expressed that to superintendents. We let them know far in advance what the timeline was as far as announcing the public, and also when the opening dates would be. Department of Health recommended to do it in stages, starting with the younger students first, and Dr. Everson will discuss rationale. So we set the dates, which allowed the superintendents to move forward in talking to their staff and talking to their parents as far as how they want to move forward on what their timeline is going to be. And so we've seen already a lot of school districts that are taking a cautious approach and are going to actually maybe start a little bit later or spread it out even more.
Okay.
Any other questions?
Yeah, last question. I thought that was the last one. There's one more.
No problem.
So the dates that you picked were related to the disease in the county, or were related, because we didn't do it at the beginning of school. So I think there's some confusion about the dates and why that happened.
Yeah, and I'll let Dr. Everson discuss that further, but I know compared to at the beginning of school, what the rates were compared to what they are now. And also the timing, because when we talk to superintendents, we ask them what kind of timing do you need to finish up, finalize your plans. And so based on our conversations with superintendents is how we decided on what dates to move forward.
Any further questions?
Yes, this is Kay Funk. I have some questions.
Okay.
When we talk about school reopening, when we talk about going from phase 1 to phase 2, we're talking about turning a corner from case finding in a high prevalence situation to a lower prevalence situation. And I think that this requires a different strategy. And I think that there is also a need for expertise, which cannot be expected or pushed off on the school superintendents or the school nurses. And of course, Dr. Everson will address this. Maybe Dr. Cleary also has relevant remarks, but we really also need expertise from outside of the health district. And I'm concerned that I'm not really hearing that. In addition, we need to see, we've been testing people who are symptomatic, meaning that they self-identify as needing testing. That's going to have to change. We will need to have testing for people who are minimally symptomatic or asymptomatic, and more careful screening testing in the contact populations. And I'm just concerned that I'm not seeing a plan for that. It doesn't have to be done today, but I really think this is an area in which we need expertise, and I'll be eager to hear Dr. Everson's remarks. Thank you.
Thank you, Doctor. Any further questions? Hearing none, we'll move on to local emergency response coordinator, Nathan.
Morning, everybody. I will keep it fairly brief as I know there's more report outs. We continue definitely putting the gas pedal on the response towards COVID within our county, despite our numbers heading in the right direction and us continuing to move forward. We know we still have a lot of work that needs to happen within our community. And we also are aware that there's other things that pop up as we're responding. We saw wildfires, a prime example of that. We're heading into flu season, which will definitely take its toll on our healthcare system that we're paying a very close eye on. Just wanted to give a quick update specific to wildfires. We were able to provide about 11,000 KN95 masks to agricultural workers specifically as they had to work in those conditions. And then we also partnered with the Washington Tree Fruit Association, who was able to provide over 100,000 N95s and KN95 masks, not only in just in Yakima, but really throughout the entire region to agricultural workers as well. So as these things come up, our blinders are not just on COVID, but it's everything else that's going on in our community as well. With that, our biggest planning going forward, like Ryan talked about, has been ensuring that we continue to have equitable and accessible community-based testing within our community. And then also looking at how we can start planning towards mass vaccination and what that looks like specifically within our community. There's been a lot of talk on the state level and certainly throughout the nation as far as different strategies and things like around mass vaccination. So it's something we're working towards. So we'll have some plans and some frameworks in place when there eventually will be a vaccination. And I think I will just stop there. Happy to take any questions. Thank you.
Thank you, Nathan. Any questions for Nathan? Hearing none, we'll move on to Dr. Everson.
Thank you, Ron, and good morning all. I am actually going to start with just some brief comments about influenza, maybe for a little bit of a breather from COVID for a while. So I would be remiss if I didn't mention that we are officially starting influenza season tomorrow. October heralds the new influenza season, so 2020, 2021. And I do want this to be on people's minds. We've been talking about keeping our community, keeping our healthcare system safe from a COVID standpoint, but we can also not afford to see a large surge in influenza cases. Those of us in healthcare and public health are somewhat hopeful that with improved cough etiquette and masking and hand hygiene, that hopefully we'll see a bit less spread of influenza and other respiratory illnesses this year. But we also feel that it is just as important, if not more important this year, that folks get their influenza vaccination. There has been a reformulated influenza vaccination released this year. When I say reformulated, every year we look to see what the circulating influenza is around the world in places that we tend to get our influenza from. So the current recommended influenza vaccine is specific for the kinds of influenza we think we're going to see in our communities. It is available in Yakima County right now for those who are uninsured. The State Department of Health has plans to offer free vaccine to children and adults. So if you don't have insurance, we can still find a way to get you influenza vaccine, and anybody over the age of 6 months is recommended to have influenza vaccine. So I would urge everyone to get their influenza vaccine. There's also some concern about not getting it too early, but really this is the perfect time, September and October, when you need to get your vaccine to be protected, as we could see a rise in influenza anytime between now and typically February. Our peak usually is in December or January. But it could be any time in the next couple of months. So please, everyone, get your influenza vaccines. I do want to say that we have had additional influenza death in our county since the last time that we spoke. So just a reminder that influenza isn't just an inconvenience for some of us. We're healthy enough and lucky enough to not have severe infections, or if we get our vaccine to not get an infection at all, but influenza does kill. So please remember to get your influenza vaccine. I also want to mention that since the last time we spoke, we have seen another case of multisystem inflammatory syndrome in a child, and I am moving back to COVID now. That is the severe illness that children can get after they've had COVID-19 infection. So we have had additional child hospitalized with MISC, or multisystem inflammatory syndrome, since the last time that we spoke. And that's just a reminder that while children are less likely to have severe infection, they can still have some severe outcomes. So we are watching the safety of all of our community members. So turning to our COVID-19 stats, I'm going to start with the best statistic of all, and that is 0. As of yesterday afternoon, we had 0 patients on ventilators for COVID-19, and we've seen that for much of the past month, so that's a great statistic to start with. As of yesterday afternoon, we had 12 COVID-19 patients in the hospital compared to 15 during our last Board of Health meeting. And just as a comparison, the meeting prior, we were at 33. So we've continued to downtrend with the number of folks needing hospitalization for COVID-19. And then as a reminder, we peaked at 61 patients, not including a number of transfers out of the county, and that was in early June. As far as our daily case counts, we're averaging about 21 cases per day over the last 7 days, and that's compared to 28 last month. So that has continued to trend down nicely. We've been holding steady for the last few weeks. And as a reminder, at peak, we were seeing 150 cases per day, so significant improvement. And then we have lost 1 more community member to COVID-19 in the past week. And as a comparison, when we were peaking with COVID in June, we were losing 1 to 2 community members per day. To date, we have tested approximately 68,000 people, which is amazing to me. And as Ryan commented, we're continuing to expand our testing capacity. And to respond to Kay, we have been doing our best to try to promote, I'm sorry, Dr. Funk, we've been trying our best to promote testing for those who are close contacts of COVID cases, regardless of whether or not they have symptoms, for months. So I will gladly take any additional ideas you have to be reaching people to encourage them to test with exposure and not just waiting for symptoms. We do have that capacity right now, and we have for some time. Talking about masking rates, as you're all aware, we've been doing regular community surveys to observe masking in public. And at our last Board of Health meeting, we were at 96% masking in public. We have seen a slight decline in that to 90% with this past survey. So I just want to take an opportunity to remind people that it is just as important now as it was a month ago, as it was 3 months ago, that we be wearing our masks when we're around people who are not in our household. So moving on to the state risk assessment dashboard numbers. The first number I'll comment on is our hospital capacity, which we know has been a challenge when we were at our peak. Last month, we were at approximately 53% of hospital beds full, and now we're at 49%, so continued modest improvement there. When you look at the percentage of our hospitalizations due to COVID-19, last month we were at 5.3% of all hospitalizations being for COVID-19, and now we're at 3.8%, so that's also a nice continued downtrend. And I didn't mention that first goal for hospitalizations is to be less than 80% capacity, so we've been meeting that metric for quite some time, and the goal for COVID-19 hospitalizations is less than 10%, so 3.8% is quite good, so meeting that metric as well. Our test positivity, if you remember when we were at our peak, was between 25 and 30%. And most recently, we are at 8.3%, so a significant improvement. The state metric is for test positivity to be less than 2%, which would be 1 out of every 50 tests being positive. So we're still a bit above the metric, but quite a bit better than we were at our peak, and still seeing improvements over time. With respect to our rate per 100,000 per 14 days, which is a number that people keep in the forefront of our mind because it's one of the ones that's followed most closely for phase movement, the goal is to be less than 25 cases per 100,000 population over the last 14 days. We peaked at almost 700 per 100K. At the last Board of Health meeting, we were at 219 cases per 100,000 population per 14 days. And our current case rate is 118 per 100,000 per 14 days. If you follow the state dashboard, you will notice that there is a difference. The state dashboard most recently listed us at 84.9 cases per 100K per 14 days. And some of that discrepancy comes with there being difficulty in reporting into the state database if there is any missing or discrepant piece of information. So we have a real-time tally of all of our positive tests. These are not suspected individuals. These are positive tests. We have a real-time tally of all positive tests that we keep internally. So ours is more real-time than what you're seeing on the state database. We're happy to answer more questions about that if you have concerns, but our current number is 118 per 100K per 14 days. So through our collective hard work with all of our masking and our social distancing, keeping our hands clean, working from home as much as we're able, isolating, quarantining, we have made some really significant strides over the past 3 months. We hit our peak about 3.5 months ago. So we're in a very different place now than we were 3 months ago. And this is something that we have done together. We have improved our community safety. And as a result of all of this work, we have continued to be able to take some steps forward with things like limited indoor dining capacity, some indoor religious services, some fitness activities, and then most recently some expansion of agritourism. And we're now in a position where we can consider a cautious reopening of schools, starting with our youngest learners. And we have had positive conversations with the State Secretary of Health and the State Health Officer explicitly about this, just to address your concern, Dr. Funk. Stable case rates close to state recommendations for some in-person learning, taken into consideration with other positive factors like our low hospital census, our low hospitalization rates, excellent ICU and ventilator capacity. We have stable and improved test positivity, and we have this expanded internal capacity to support schools and respond to cases. All of this has put us in a good position to be able to take some of these measured steps towards in-person learning. And by measured steps, I mean lowest transmission ages first. We know that younger children seem to transmit less than older children, than teenagers. And as we've done with all of our movement during COVID-19, there's an observation period between these movements to ensure that we don't see rising cases or to make sure that we're not overwhelming our public health response or causing excessive disruption to schools and families before we move forward. To Commissioner Baker's question, the dates as far as when to reopen were based on a couple of things. One is we wanted to wait 3 weeks after Labor Day to give a solid observation period to ensure that we're not seeing rising cases. We also had some expansion of activities like indoor dining, indoor religious services, and wanted to observe to make sure that we weren't seeing a rise in cases. So that was the initial piece of where the dates were chosen from. And then once we got to that 3-week observation period and felt comfortable giving a recommendation for this cautious movement forward, we needed to allow schools time to prepare themselves and for families to prepare for in-person learning. So that's where much of that timing comes from. So to kind of get back to the 30,000 the view here, our current level of safety in our county has all been very hard earned. And now is not a good time for folks to be relaxing or disregarding all of the efforts that have led to this success. And there are some who might suggest that it is time to relax and to stop making all of these efforts. There has been some messaging in our county that because we have less than 1% of our residents currently infected with COVID-19, that we no longer need to wear our masks or observe social distancing requirements. And this is a pretty misleading statistic. At our peak in June, we had a 10-day period, which is the infectious period of COVID, of 1,334 cases. And that resulted in an overwhelmed hospital system and numerous patient transfers out of the county due to inadequate staffing to care for everyone who needed it. And then we had a number of deaths associated with that large spike in cases. The prevalence of people with active COVID-19 at that time was 0.5%. It was 0.5% when we hit our peak. So being at less than 1% of our county actively infected is not something to celebrate. It is not a meaningful statistic, unfortunately. For the 30 days around when we had that peak, if you're looking at a month of cases, we had 3,622 people with active COVID-19 in that month around our peak. And that was 1.4% of the county with COVID, which I would say is a dark month in our history to have so many people sick and in the hospital and so many deaths. To date, 4.8% of our county has had confirmed COVID-19. So for anybody who is thinking about herd immunity and whether or not that is the right way for us to be approaching this, in my opinion, that would be a simultaneously hope for infections and deaths at least 14 times higher than what we have seen to date if we are to reach a modest level of herd immunity of about 70%. And those infections and deaths disproportionately impact not just people over 65 and with underlying health conditions, but are more likely to impact people of color and our essential workforce. For those folks who have been vocal with concerns that the only COVID-19 deaths that count or are in people who have no additional diagnoses to write on a death certificate, that means that you're writing off deaths in children with asthma, working parents with diabetes, and individuals over 65 who have decades of community service. And I would say a life is not invalid just because somebody is over 65 or has a chronic health condition. I wholeheartedly support efforts to give hope and to build resilience. We all need more hope and resilience in life right now. But that is not done through misinformation, and it should not be done at the expense of community safety. We're heading into cold and flu season when we all take our activities indoors, and we'll likely see an increase in respiratory illness, including COVID-19. It's going to be even more important to continue to do all of the things we know we need to do, like social distancing, keeping masks on when around people outside of our household, and continuing to connect and celebrate and socialize virtually as much as possible. I continue to be really grateful to our staff, to our board members, to the entire community for all of our collective efforts to improve health and safety of the county. And I really urge everyone to stay vigilant. We are all tired. I can assure you that all of us are tired. I know all of you are tired, but now is the time to buckle down and recommit to community safety, so that we can reopen our schools, we can further reopen our businesses, we could keep our hospitals safe and prevent any excess cases and deaths in neighbors and loved ones. So thank you all, and I think I've taken up enough time, and I will stop there.
Thank you, Doctor. Any questions or comments?
I have a question. You answered most of them again, and I know you're preemptive with that. Thank you. My question is about the businesses that are still closed after all these months. And I heard you say observation period, so I know that they are all eagerly waiting to know what that means to you as far as moving forward on any more openings, and especially with the schools and the gradual plan. And I'm hoping that doesn't put them at the end of the dates and get us far down the line on that. So, and we've had, great discussions with Kathy Lofi and John Wiesman, and I know you're working hard on this issue. They do have a level of comfort, it feels like, in our practices here, but I'm hoping that includes moving forward on businesses and other things as well, like churches. Thank you.
Yeah, I appreciate your question. Commissioner Baker has been able to participate in several of our calls with the State Secretary of Health and the State Health Officer, and they have expressed, I'm not sure what word I'm looking for, they have been pleased with how cautious we've been in our ability to work together as a community to prevent our situation from being worse than it was. So there has been some appreciation for how measured we have been. I know that they are actively looking at how they consider movement for all counties, and many of the counties have been on pause for some time because of a surge in cases late in the summer. So they're actively considering, what should the plan be moving forward? Is our current plan the best plan? Do we need to do some reconsideration of what this looks like? So I know it is in the forefront of their mind to be making sure that the current plan is the right one. They're also considering things like, we have been in modified phase 1 for some time. There are counties that had moved to phase 2 before they had a surge in cases who may have more cases than we do right now. So in thinking of things like fairness, this is all in the forefront of their mind. So they're actively considering, is our plan now the best plan? Does it need to change? Is there a way to make it more equitable? So it doesn't really answer your question for when things might happen, but I do want to reassure you that this is on the forefront of everyone's minds right now.
Yes, and if I could just add Dr. Everson, thank you. We are moving into a period, as Dr. Funk talked about in terms of planning, where we live with COVID. We're not in a situation where we can overcome COVID. And so the vigilance that Dr. Everson is discussing is exactly what we need to do. How do we live with and manage safely our lives as we navigate these really tricky waters? And that is something that we are in active conversations with the state about, and our continued appreciation for the winter months that are coming, and the difficulties that we know are going to be there if we don't have plans in place that really attribute the fact that people will be indoors more often. So this is actually the time where we plan for living with COVID in a safe way, and Dr. Everson certainly has addressed that. Thank you.
Thank you. Any further comments?
Yes, this is Kay Funk. I have some comments.
Yes, Dr. Funk.
First of all, I'm sorry that I'm talking so much. I know I don't want to be talking just to hear myself talk. I'm sorry for that. But I'm concerned that we have communication and planning problems that are not solved. And so let me list a couple. When I looked on the website and what Dr. Everson mentioned, the discrepancy between 118 and 84, and I'm going to call that a prevalence rate, although I realize that it really isn't, but that discrepancy is what's posted on the website. Is that reflecting the state database or the local figures? Okay,
So
well,
if you follow our case numbers that we post every day, you get to a case rate over the past 7 days of 118 per 100K per 14 days. We are not the only county that is seeing a difference in our internal tallies based on positive test results and what is being reported through the state database. And I've also validated with other counties that the discrepancy that they're seeing is similar to ours. So the state is aware of this. The state is working on this. It's not unique to us.
Okay, well, my concern about that is that's their responsibility to make that right. And working on it is not really adequate. And considering whether we have you said several times that they're considering whether we have a safe plan to move forward into this next phase. Considering isn't really good enough. The science of epidemiology, the science of public health spread, I mean, this has been developed over a long period of time. It's not new. What we're trying to talk about is specific implementation steps, and that needs to be managed, and those problems need to be solved. So I'm going to be a little grumpy about that. I also have a question. What percentage of new cases are being identified from contact tracing rather than individuals self-identifying as the need to be tested? Because we should definitely be tracking that, and that should be public.
I don't have that number. We can work on that and get back to you, and I appreciate the comment.
Well, we need that number. Otherwise, we don't know whether contact tracing is working. Secondly, if we're going to have children in the schools, working with children is children cannot give consent on their own. They have to have a parent to give consent to testing or any kind of intervention or taking them home from school. And so that means you have to have both the child and the consenting adult there at the same time to do anything with the patient. And so I'm very concerned that do we have a way that school staff, school nurses or non-nursing staff can get consent and collect and submit a COVID test for a child with a fever? Because if we don't have that, if we separate that from when the child goes home with the parents, then you've turned a 20-minute time commitment to an all-day time commitment to try to get that consent and collect that sample and get it in. Now, you said, or we've had posting that we have at-home testing available. That should be very easy for school staff to use for testing. And getting a consent and properly labeling the specimen, that is not a high level of expertise, and that needs to be available in the schools. Also, are we going to encourage the schools to offer flu shots on site in the schools? Because that would certainly, it would not only promote getting more children flu vaccinated, but it would sort of start to create a template for COVID vaccination when we have that available. And I don't think that these are expertise problems for our health district. I think that the state needs to give us expertise on this and solve these problems and have these problems in place before we can do school safely. And I will also reiterate that that everybody in the community needs to be aware that our level of vigilance needs to continue to be tip-top, because this whole thing could rebound so fast and end us up where we were in July. And also, I'd like to ask, could we ask Dr. Cleary if he has a reaction to this?
Yeah, I do want to hear Dr. Cleary's reaction. I have at least 3 or 4 things that I'd like to help answer for you first. Is that okay, Dr. Cleary? You may be muted. So Dr. Funk, you ask excellent questions. And I mean that generally, but I also mean that because they're all things that we have asked at the state level when we have health officer discussions together, which we do for at least an hour and a half, at least 3 hours a week. We have calls between health officers and our local health administrators. So we ask all of these questions, and I know you're asking for state guidance on these things. We have been getting state guidance on these things. I am specifically participating in a work group around school response, around testing in schools and what that should look like. There is no current suggestion or request for school nurses to be doing testing on site. We do have a plan within our county for how to make testing best available for schools and for families and children. So that is something that we have considered over the past month, is making sure that we have real-time testing capacity to respond to cases in schools, cases in staff or children. Your question about home testing is a good one. We early on requested a number of these home tests from the state. We saw benefit in our county to be able to provide that level of convenience for folks. That is something to consider. And that is part of the consideration of this work group that I'm on for the state around testing for schools. I like that you're asking about influenza vaccination in schools. The state does have a vaccination plan, which includes expanding vaccination access for adults who don't have insurance. I may let Lillian Bravo respond a little bit to what our planning has been around that. And really, we've been in planning for how to expand influenza vaccination for, I want to say, the past 6 weeks. So that is something we've been actively working on and specifically thinking about with respect to schools. I'm in the interest of time. Dr. Cleary, did you have some thoughts you want to share or questions for me? And if audio is not working, maybe if you're still on, you can put something in the chat box and I will watch for it.
Can I throw something in while we wait for him? It's really quick, I promise. I feel like we have an issue with the public trust and on the numbers that you mentioned, the discrepancy. And I'm looking at the health district site right now, and I see that what we're talking about specifically. Could we put something up there so the public can read the explanation you just gave, so that when people go look, they'll know why?
Yeah. No, thank you for that suggestion. We usually do that if there's a discrepancy in any numbers between state database reporting and what we're reporting internally. So thank you for that. We can work on that.
I don't see Dr. Cleary coming on. Like you suggested, Dr. Everson, maybe you can communicate via the chat box or offline. If you're ready, we'll move on.
He did have a comment here. It says, apologize for lack of audio, but agree with concerns regarding testing in schools in terms of consent and administration. Yeah,
Okay.
and those are considerations that we are taking in our decision making.
Good. Okay, I see that. Any other comments or further questions? Thank you, Doctor. We will move on then to Melissa for her report.
Morning, everyone. I'm Melissa Stixberry, Director of Disease Control, for those of you that are community members on here. A lot of great reports that touched on a lot of what I was going to talk on. I'll just follow up with the flu and what we're doing for that. Every year we reach out to the local hospitals to have them report to us weekly their numbers of flu tests that were administered and their positivity rates. So we've started that. This will be our first week that they're going to restart reporting those. So we'll have numbers hopefully on our webpage next week with those. Dr. Everson mentioned we had one additional MIS, or multi-inflammatory syndrome, related to COVID. That makes the fourth one in Yakima County related to this, which in Washington State, there are currently 15. So we have 27% of the MIS cases in Washington State, which is pretty significant. King County is following us with only 3. The discrepancy on the webpage, I'll just touch briefly on that. That is something that we've reached out to the Department of Health with their epidemiologists to run our numbers and compare it with what's in there. So it is something that we're addressing and trying to determine what the cause is for that. And we will be working on that to find out what the discrepancy is. I think part of it is related to what we call point of care testing, or the rapid tests that are being done. Those are getting reported to us at the health district. I'm not sure that they're getting put into the Washington disease reporting system by all of those are getting put in, which I think might be part of the discrepancy, which is something we'll be struggling with, is our long-term care facilities are getting these point of care testing kits or rapid kits that they'll, it's relies heavily on the person doing the test to report those. And then also, Dr. Funk, you had asked, I think, about on contact tracing, if we've identified cases that are positive or probable cases without being tested, but they were related to a case. Was that what you were asking?
My question was, what is the percentage of new cases that have been identified in testing because of contact tracing from a known case?
Okay. I will be able to run a report that would show what would be classified as a probable case. The health district reports only lab confirmed, but I can look at the Department of Health with contact tracing for those that they identified in close contact who had symptoms. They were counted as probable cases. I could look up that data and report that out to you if you'd like that. It won't tell us how many of them got tested, but it will tell us how many cases we suspect because of close contact with someone. And then the only other thing I have is we had, since our last Board of Health meeting, we've had a West Nile virus case reported. It's the first one in Washington State this year to be reported. That patient has since recovered, but we did send out a media release on that as well. And then last thing I have is our Department of Health team, out of the $10 million that was given towards Yakima County, not directly to us, but to support us, we've hired 9 individuals who are employed by Department of Health, but working with Yakima Health District. They're a disease outbreak response team, and so they are doing all of our outbreaks in long-term cares, H2A housing, warehouses, things that we were doing before, but we have now a much larger pool of individuals to help and stay on top of these outbreaks. So they've done a great job. They're also now going to be tasked with the schools and also doing, they were the ones that went into the private schools to do the on-site inspections, and they'll continue to do that for the public schools as well. Any questions?
Okay, this is probably not for you. It might be for Dr. Everson, but you brought it up and it reminded me on the childhood disease, the inflammatory syndrome. Is there a treatment for that, or is that, when it first was discovered, it was extremely dangerous sounding, and I wonder if they've come up with a treatment that's in the death rates and how that is for children.
Dr. Everson, do you have that information?
Yeah, I thought you might want me to take that one. So offhand, I don't have information as far as death rates. I can tell you that recovery is more likely than death. So when you have MASC, it can be quite severe. Children are hospitalized with that, but most children do recover. And as far as the treatment, there's not a specific medication that's given for that. It's more of a supportive treatment based on what's happening if they have kidney failure or if they have heart failure. So it really depends on what kind of symptoms they're having from it. Multisystem inflammatory syndrome means that they are having problems with many different organ systems in the body. So it's supportive based on what their symptoms are.
Thank you. Any further questions or comments?
I will just add one more thing. Sorry, Commissioner Anderson. With the follow-up on the schools, Ryan does meet weekly with the superintendents, and then we also have our weekly call with the school nurses, which is very helpful. We spend about an hour with them every week, touching base and answering questions. We've developed a toolkit for the school nurses, and so it's a fairly large toolkit that we adapted from King County that will talk about every scenario they could encounter and what to do, and then we work through that. Any questions that they have from previous weeks, we work through that every week with them on that call. So we're in close contact with the school nurses weekly, and then on as needed, they call us for individual questions as well.
Thank you. That's very important for the public to know, I think, those kinds of interactions you're having with the schools, not just superintendents or principals, but also the health nurses. That's very important for the public to know, especially the parents of the kids who are attending, so that they can maybe contact those nurses individually as they feel they need to.
Mm-hmm.
That's good to know. Any other? Go ahead.
Yeah, this is Kay Funk. One of the most important tools is to be able to do a test at the school when the child is there and the parent comes to get them. if that's not in your toolkit, then the toolkit isn't really adequate for the problem that we're facing. And I think I understand why this tool is not there. And, but I think it's just adding multiple layers of bureaucratic procedure before you get done what needs to be done. The school superintendents and the school nurses can't solve this. The state public health officers have to figure it out. That's my opinion. Thank you.
I have a call today from 3 to 4 to talk about just that.
I think there's also several concerns around, at least from my perspective, if we have a sick individual at the school, I think the goal is to get them out of there as quickly as possible. And so if you're delaying that because we're doing testing when we have the resources within our community to test these students, I think the less risk that we put on our school nurses, who we are already in shortage of, I think the better. We would hate to lose our school nurses due to an exposure and then not have them there to help us should they have a cluster outbreak.
This is Kay Funk again. I absolutely disagree that that should be the priority. There are, if the child is there and the child is sick, the child needs to be tested expeditiously. And if you lose, if you have difficulty following up with that child and that parent, and that delays the testing, that is a threat for the whole school. So, Dr. Everson, I hope that when you talk with the state health officers, you will tell them that you had a board member who was quite crabby about this. Okay? Thank you.
I will certainly share your concern.
Okay, if there's no further comments or questions, we will move on to Sean.
Good morning, everybody. I'll keep it as brief as I can out of respect of all your time. More recently, our EH division has gone back to conducting a lot of our normal environmental health services with added protective measures, wearing of masks, social distancing, and limited people on site during our field inspections. It's been going well, as Chase showed in the financials. We're rebounding a little bit. We're getting more applications. So we're seeing some movement in land development, drinking water, and things like that. So that's a good sign. We are now conducting our food safety inspections. What's unique to this right now is we've implemented a COVID-19 consultation assessment to that, given the new guidance for indoor dining and all the guidelines that go with that. We felt it was important to offer our support to our food establishments and taking a look at how their operation is going, what safety measures they have in place to help them implement best practices for COVID-19 infection prevention. So that's a part of our routine food inspections now and in the foreseeable future. I also wanted to talk about some of the questions that came in from the public. One of which was, why are we requiring businesses to submit a safety operations plan? So the reason behind this was we wanted to get businesses that were able to open under certain restrictions that are unique in modified phase 1 to have some self-awareness about how COVID-19 safety and infection prevention is specific to them. We wanted them to be knowledgeable and trained in those best practices, and developing a well thought out and detailed plan kind of holds them accountable and helps them learn what it is they need to be doing specifically in our modified phase 1 and moving forward. Another question we received was, why do we not have plans for phase 2, 3, and 4 posted onto our website? I'll start by saying that, again, modified phase 1 is unique. A lot of the guidance documents and toolkits are specific to Yakima County and maybe the 4 other counties in modified phase 1. So they're quite customized compared to some of the guidances that are coming out of the governor's office. That's why we have a lot of that detailed information on our website specific to modified phase 1. However, the Washington Safe Start Plan and all of the guidance and toolkits for phase 2 and 3 are linked on our website and with the governor's office website. No counties in phase 4 yet, so we haven't seen much guidance come out for phase 4 at this time. So that information for phase 2, 3, and 4 specific to different business types is available. And that's what our toolkits and our guidance documents will look like once we get to phase 2 and 3, because they'll mirror what's coming out of the governor's office. Ours are different from modified phase 1 because modified phase 1 is unique to us with our roadmap to recovery and the restrictions that are in place around different activities and business types. So I just wanted to clarify that, and I'm happy to take any questions regarding those things. But other than that, that's all I have for now. Yeah, any questions?
I'd just like to add one more thing, if you don't mind. We watched as other counties that moved into phase 2 and phase 3 actually have an explosion of cases after that. And so we have been methodical because we wanted to have an active partnership with business. We wanted to assist businesses. And as Sean mentioned, we wanted business to recognize how they can keep themselves, their owners and their teams, their staff safe. So that's been really one of the pleasures of working with local businesses here, is watching businesses reopen without actually having large outbreaks. And that's been really something that we've committed to here. It's a part of our plan in every phase of this opening, which is to make certain that what we do open, we do so safely and well. So I just want to share that. Thank you.
I'll add quickly too that a lot of the EH staff are, we have 1 or 2 of them minimum in the office at a time to help with phone calls, because we do get a lot of questions specific to business and different events that people want to do, and EH has been tasked with helping guide people through those questions and processes. So we are here, we are available to offer over the phone guidance, if you will, for any business activities or activities people want to do that aren't necessarily identified specifically in our roadmap to recovery. We're here to support the community in that regard as well. Thank you.
Thank you, Sean. Any further comments or questions?
Sean, I have a question. It's more of a clarification. So could you go through briefly the timeline? Because I think there's a lot of confusion in the community about how everybody else got to phases 2 and 3 and we got stuck. I think that would be important to explain to everyone. And then also how we've been chipping away at all the phase 2 activities, how we have gotten so modified, almost like 1.9 toward phase 2. How that's been working, I think people don't understand.
Right. So when the Safe Start plan was implemented by the governor, for phase 2, we had to get to less than 25 cases per 100,000 for a 14-day period, and a less than 2% positivity rate of all the tests that are conducted. That's 2 of the metrics. And then we have to, I believe, for every positive, we have to conduct 50 tests. We have to have under 80% of local hospital capacity utilized. And then I believe it's less than 10% COVID patients are the different metrics that are being measured that dictated what counties moved to what phase. So a lot of counties that were meeting these moved to phase 2. And then again, some counties got to move to phase 3 once they continued to downtrend for the 3-week waiting period that they had once they moved phases. So then once we got to our modified phase 1, as that was announced, a lot of these counties started seeing an uptick in cases, and the governor put a freeze on the moving forward to different phases. So we haven't been able to move to phase 2, obviously, but modified phase 1 has been unique that we've been able to add to it as we go through this, while other counties have been stuck at phase 2 or phase 3. It's been positive for us in a lot of regards that we've been able to add a lot of the guidance for phase 2 around a lot of different businesses and activities. But there has been some frustration in that. When will this freeze go away so we have the opportunity to move forward in phases? Exact dates on these things, I don't have those in front of me, but that's kind of the what we've been working through. And you're right, we're utilizing more phase 2 guidance than modified phase 1 at this point. So as long as we continue to see our numbers trend downward, once that freeze is lifted, we can see a consideration moving forward.
And
I will also add, you may be ready to say the same thing I am, Andre, but in the original Safe Start plan, there was not a mechanism built in for any county to move backwards phases if they see a spike in cases. So that was absent from the plan, and understandably there is quite a bit of concern and pushback around the idea of counties that had moved to phase 2 or phase 3 moving back a phase when they see their cases increase. So that's all part of the consideration that I mentioned before that folks at the state level are making in what should be the best plan moving forward to make sure things are equitable.
yes, thank you. And Commissioner Baker, I was just going to add that we've asked the state to really embrace a whole community vision as opposed to specific portions of our community or disciplines of our community. It's exceedingly complex. I think it's not easy for the public to follow, and we would like a simpler version, but as Dr. Everson pointed out, that version we've understood from the state would have to expand and contract based on the dangers in our community. So that's something that, again, as Dr. Everson mentioned, did not happen in other parts of the state. I think actually that was well thought out. Obviously, we have been in modified phase 1 for a long time, but we've also been methodical and safe and measured in our approach. And I'd like our community to be acknowledged for that.
Just to follow up too, I want to make it clear that when the Safe Start plan was open and people were advancing, our rates were high, which is why we didn't advance during that time. And unfortunately for our county, working hard through it, we got to where we are after the system was frozen. And that's the confusion I think people don't understand. You know, we're doing extremely well here, but the system has been frozen by the governor.
Thank you, Sean. Sean, I have one question about when folks or somebody calls in, am I to make the assumption that you're tracking the questions and types of inquiries so that you have a running log of the concerns of the community?
Yeah, if we're seeing a trend in our phone calls, at one point religious services was a really hot topic, and we're getting a lot of similar questions around that. So we would huddle up, as Chase mentioned, our front desk staff, some of our EH staff are involved in meetings multiple times a week, and we discuss, some of the frequently asked questions that we are seeing, what the correct response to those is, what's allowed, what's not allowed, revolving kind of the hot topic of the week, which it seems to evolve into a different topic as the weeks go on. But yeah, we do huddle up and talk about those and have everybody prepared for an appropriate response. Typically, if there's one that comes way out of left field, I ask those staff to forward that to myself so I can dig in a little deeper and find the appropriate response for that person. And then educate staff as I figure that stuff out as well.
Thank you. Any other comments or questions?
One last thing, Sean, too, is when we're dealing with business reopening, especially, I know that there's confusion too about who is making the decision, because I know when the schools went to a local decision and here, it made everybody think there was local decision-making happening on everything else. So there's quite a process to move forward on any sort of activity. Can you maybe share what that is real quick?
Yeah, so I know that some of our administrative staff will be in meetings with the state health officer and the Secretary of Health, and they discuss, what our numbers are looking like, what our trends are, what our COVID-19 activity looks like in Yakima County, and what we feel would be safe to move forward with certain business activities and different social recreational activities across the board. And we have those discussions at the state level, and essentially those recommendations get approved or not approved, or they get adjusted, for indoor dining. Instead of 50% capacity, it's 25% capacity. So there's adjustments that are made in what's allowed compared to some other guidances in like phase 2, for example, to be a little bit more limited in our modified phase 1 that they feel we could have happening at a safe level and not drastically increase the risk of transmission. I'm not a part of those meetings personally.
Yeah,
Well,
I might add, go ahead, Andre, you first.
Oh, no, after you, Dr. Everson.
I would add that there are state level orders for permissible activities for many things, but for schools in particular, there are recommendations and guidances from the state, but there are no orders. The decisions around opening or closure are largely made by superintendents in consultation with the health district. So there are no orders from the state specifically with respect to schools. I know that creates some confusion because there is a process difference depending on what we're talking about, but hopefully that helps clarify a bit. Andre?
I was just going to add from a different perspective that you're correct, Commissioner Baker, that the decision to open up recreational and business activities lies squarely with the governor's office.
I'd like to just real quickly add, very early on in our response, we focused on a system-based approach to our response and developing and building systems that will not only fix a problem tomorrow, but also pay off 6 months down the road and a year down the road. And it's these systems that have allowed us to show the governor's office that we have certain capabilities in our community to handle whatever may come through the door. So a prime example of that is specifically with our business community, and with those Safe Start or with those plans that the businesses create, it's less punitive for them to do more work, but it's really a system to give them the information that they need to be successful and to keep themselves and their staff and their customers safe. So we continue building these systems as we move forward to increase our capabilities within our community and to ensure the safety of our community. And it's really been a pivotal in the success in our response.
Thank you. So if no other questions or comments, we will move on to Lillian for her report. And Lillian, I just want you to know your dog made a cameo appearance just a few minutes ago, unknown to you.
They're always there. There's 2 of them. Maybe you'll see the other one. Good morning, everyone. So Lillian Bravo, Director of Public Health Partnerships. So I'll be brief. I'll start with the update on the flu work that's been happening. And I'll say that we've been working for several months now, actually, with different partners from our federally qualified health centers, the local hospital, managed care organizations or health insurance plans, and our educational school district 105 to make sure that we can move forward and be prepared for, one, immunizations in general, because we want to make sure that all of our children are caught up on general immunization requirements, but also with flu. So for that, our federally qualified health centers, that being Yakima Valley Farm Workers Clinic, Yakima Neighborhood Health Services, and in discussions with Community Health of Central Washington, are planning on doing school-based flu clinics in these coming months. What that's going to allow is anyone who is part of that school district to come and get their flu shot with the Department of Health authorizing the adult vaccine program to offer flu for free this year, that means that both the children and their family members will be allowed to get their flu shot at these clinics, regardless of whether they're insured or not. So that's going to be actually very big for our community. We have a lot of individuals who are uninsured. So we're very happy to see our partners move forward in this way. So far, we've been working with different school districts such as Toppenish, Mapton, Union Gap, West Valley, and several others that are finalizing their plans as well. So we are also planning on launching a campaign that's going to be targeted towards school-aged children and their families, again, promoting people to get that flu vaccine. That will be launching here in a few weeks. And that's going to be in partnership with, again, the different clinics to make sure that we can get as many as people as possible getting their flu shot this year to help in preparation for the winter that we're wanting to protect as many community members as possible since we're still dealing with COVID-19. Outside of that, I wanted to give a quick update on the community health worker campaign that launched on September 1st. So I had mentioned that at the previous Board of Health meeting that this campaign is being funded through the Department of Health. And we had hired 20 community health workers from the community to help primarily our monolingual Spanish speaking community. The goal is to reach 2,000 families by, sorry, there's a cameo. Okay. To reach 2,000 families. And as of this morning, they've actually reached 1,000 families in 1 month. So that's huge. We have gotten a commitment from the Department of Health that they will be providing additional funding given the success of the campaign so far. And I'll be happy to report on that next month. With that, I'll conclude. Is there any questions? Thank you.
Not hearing any questions or comments. We will move on to other business. Is there any other business?
This is Barbara Hare, and I just wanted to bring this up. I know we've talked a lot about school openings, but I wanted to share this. The Hara Community Christian School opened for in-person school on September 2nd, and the school administrator told the school board that the health district staff was very helpful in making the preparations for the opening. She said it was apparent that the health district staff members really cared about seeing that the school opening would be safe for the students and the teachers. Just wanted to share that so that everyone would know how we know our staff is doing well and cares about what they're doing, but it's nice to hear from someone who's actually had the experience of having them help them.
Thank you, Barb.
Yes.
Any other questions or comments? Hearing none, I will entertain a motion to adjourn. Anybody?
I move the adjournment of the Board of Health meeting on this Board of Health meeting on September 30th.
Do I hear a second?
I'll second that.
It's been moved and seconded. Any discussion? Hearing none, all those in favor? Signify by saying aye. Aye.
Aye.
Any opposed? Motion carries. We are adjourned, and thank you all very much for all your work that you're doing, and we'll just continue to march on. Thank you.
Thank you.
Thank you.
Thank you, everybody.